Thank you, and thank you, dear Daria, for kind invitation. As compared to our colleagues from the Britain, I would say that we are Russian. We are not only mentally resilient and patient, as you mentioned, but also we are no hurry. Yes, that's why the
Okay.
results of
Okay.
Correct. That's okay. Today I will be talking. I will be focusing on on three topics in regarding the topic what we're discussing now. Firstly, about online services made by the Union of Mental Health for mental health. Next, I will be talking about organization of mental health inpatient service functioning here in Moscow. When I am working for with my friend Timur, who was previous speaker, and the last one, it's a part which I will make on behalf of my colleague from St. Petersburg about his uh, observational study in private mental health outpatient service clinic in St. Petersburg during the COVID-19 pandemic. We do not know exactly the acute and long-term consequences of the COVID-19 lockdown and social isolation on mental health. Also, worries and uncertainties about the pandemic are common, and for some, they can cause distress and impatience for social and occupational functioning. And we also know that there are some vulnerable people who may include people with severe mental disorder, people who recovered individual, and those who become mentally unwell, firstly in response to anxiety and loneliness surrounding the pandemic. Also, health workers who come in close contact with virus and are exposed to traumatic events such as death and dying, that making highly challenging decisions, are particularly at risk of stress responses. Uh, from psychopathological point of view, the COVID-19 pandemic is a relatively new form of stressor or trauma for mental health professionals. It has been compared to the natural disasters such as tsunami or earthquake, as well as artificial disasters such as war. But there are very big differences between these two stresses. The pandemic and the related containment measures, firstly, quarantine, social distancing, and self-isolations, can have a detrimental effect on mental health. We know that increased loneliness as well as reduced social interactions might be regarded as risk factors for schizophrenia and MDD, major depressive disorder, acute concern about one's own health as well as health of the beloved one, firstly elderly people, sick people. So uncertainty about the future can generate fear, depression, anxiety, and if the stress are quite prolonged, if this concern are prolonged, it may increase the risk of panic, obsessive compulsive, and some other anxiety, stress related, and depressive disorder. But we can expect that if the pandemic will be over in the near future, and it will remain a problem for both mental health professionals as well as for vulnerable people, firstly our patients. In this online survey, also made by the Union for Mental Health, they among healthcare professionals and non-medical healthcare professional, each participants filled out the social demographic block. Includes gender, educational, marital status, and some other parameters, as well as standardized questionnaire, GAD-7, PHQ-9, and also they were asked to assess the condition of fear while asking the questions like how do you rate your current health status compared to the period before the COVID outbreak, etc., etc. And also there will be some questions regarding psychological support needs, do you think that healthcare professional caring for COVID-19 patients need more psychological support or not? And sorry, in the overall prevalence of anxiety symptoms was quite high in comparison with the study which we made together with Timur and other colleagues, because the level of anxiety was about abnormal anxiety was about 50%. The level of mild and more depression, according to PHQ-9 score, was about 60%, which quite high, especially if we compare with the previous online survey. And the results of this survey you can see on this slide. Firstly, I would like to pay your attention on the high risk of developing symptoms of anxiety and depressions in young people who are facing the COVID-19 patients in the hot zones. Also, main professionals, health professionals, answer that to reduce stress during their work, they need to have more personal protective equipment, as well as optimization of work and rest regime. And also, most of them answered that they need a direct consultation with specialists, as well as organizing short-term group sessions. And I know that a lot of my colleagues, psychologists, they were working and have been working till now in some departments which are treating patients with COVID-19. Also quite important, a recent paper published some months ago regarding contingency planning for psychiatric patients. There are five main blocks. Firstly, disease precautions, scanning, scanning, screening, rescreening personal protective equipment, use of relevant clothing, etc., physician workforce consideration, operational adjustment, and also group therapy changes. As reported elsewhere and from experience, it is critically important to have organized leadership, clear communication, and involving of all disciplines in decision making. It is nowadays it's quite popular. Some screening protocols and many facilities, firstly in America, they have such sort of protocols with asking the same question to try patients to risk to exposure to the coronavirus and assess level of symptom. It's quite easy to answer these questions, even if you are working in the emergency department. Also, it is quite important paper published 1 month ago by today's speaker, Avinash Souza, as well as Afzal Javed, regarding issues of psychiatric service in low and middle income countries. All these statements are also quite important for our country. We also know that patients with mental disorders may be reluctant to follow our precautions and our recommendations. It is also quite important to organize units for COVID positive as well as COVID negative patients in the same hospital. So we have to contact quite closely with specialists in different areas of medicine, infectionist doctors, as well as general practitioners, neurologists, etc., etc. The problems also we are facing as doctors in our country, the same shortage of personal protection equipment. But I would say that nowadays in Moscow, it is not a big problem, especially in our hospital. We have enough equipment, personal equipment. But of course, also our patients are facing dual stigma related to stress and related to mental illness, as we, and of course as doctors, we have monitor somatic and mental conditions quite carefully. If we compare some inpatient psychiatric services in different country, we have a lot of similarity between countries. For example, in Italy, in Milan, hospital Niguarda Hospital. Article published in March. They had the same units. Firstly, units for infectious disease units, intensive care units, psychiatric wards for patients with severe mental disorder and non-severe COVID-19 disease. And we have to, of course, assess patients in different periods of time, even 7 days after admission. But of course, in Russia, we assess, I would say, even one in a day, each in a day or each day, psychiatric condition of a particular patient. The big problems, and we know that the big problems in organizing of health services have been in America, as well as psychiatric services, and at various hospitals, psychiatric units have opened to provide acute inpatient services. Also, there are different problems in organizing the services. The process of providing services was quite different in routine comparison with the routine way, and also it is quite difficult, if possible, to engage families to participate in discharge planning for patient infected with coronavirus. It is our hospital, mental health hospital number 1, named after Alexey, and it provides inpatient mental health care for about 6 million people living in the southern and western part of Moscow. And in our hospital, we have more than 1,200 beds. Also, we provide in our hospital outpatient service. There are 2-3 outpatient facilities, which we call in Russia psychoneurological dispensaries. And also you can see the number of beds. It's about 3,000 beds in general here in Moscow. It is hospital management patients at our hospital nowadays. I would say it's quite reasonable. There are two different types of units. Firstly, all after medical admission until unit, all psychiatric patients with positive criteria are transferred to the unit for COVID positive patients, and all other patients are transferred to so-called probationary unit, observational unit, filter zone, different name for the same units, where they must stay until the response to ELISA test. Nowadays, we are using immunoglobulin test rather than other tests, as well as computed tomography test are obtained. It may take about 2-3 days to understand whether these patients need to be transferred to the let's say respiratory intensive care units, or maybe non-COVID unit. Patients with computed tomography feature of COVID-19 pneumonia without respiratory distress syndrome and or it might be different. For example, patients with only CT features of COVID also transferred to the unit for COVID-19 positive patients without positive ELISA test. Patients with absence of CT features of COVID-19 and negative ELISA test are transferred to the unit for COVID-19 negative psychiatric patients, and all patients as well as mental health professional, they wear medical mask in this department, and if they have some sort of fever as well other symptoms which may be part of COVID-19, it also might be very carefully monitored. There is a daily summary of patients with fever in non-COVID departments. Also, there are information about age, about a name, about consultation of general practitioners as well as infectionists, neurologists, and the result of the ELISA test, which may take maximum 2 days to receive the result. All staff has to report bodily temperature and health status every 24 hours during the epidemic period. The conferences are conducted online, and external visitors requires authorization for entrance of the hospitals. And unfortunately, but it's reasonable, of course, relatives and friends are prohibited to visit our patients in hospital. Also, we organize hospital provides online mental health services to the public. And just only some slide for organizing outpatient mental health service in St. Petersburg. There is no big difference regarding the visits of patients in the biggest private outpatient mental health clinic in St. Petersburg between 2019 and 2020, except for people with neurotic disorder F4 diagnosis according to ICD-10. Of course, during the months during March, April, and May, all these consultations were made online, and most of them, 95%. And among people with neurotic disorder, diagnosis adjustment disorder, as well as mixed anxiety and depressive disorder were more prevalent. It has been shown in the official report in many, as it has been shown in an official report in many countries. In our study, the number of prescription of benzodiazepine has increased about 2 times in comparison with 2019. And COVID-associated symptoms were found just only in 5% of patients. And in this last slide, I would like to pay your attention on this conclusion number 7. It is also just suggestion. Our screening survey with naturalistic, making in a naturalistic way, do not reflect the real picture of distress among the population, as well as the frequency, structure, and severity of mental disorders. The prevalence of main mental disorder, except for neurotic disorder, but also mild or subclinical, subthreshold, as for example, mixed depressive and anxiety disorder, has not been increased enormously for the last months, as many online surveys demonstrate, but it's correlate with the previous speaker, which according to our survey, we haven't found any abnormalities in terms of increasing of anxiety and depression among surveyors. Different result, and of course, maybe one of the reasons why there is big difference between online survey and survey make by face-to-face contact. It's also one of the reason of biased, and there is why there are even big differences between different surveys. But of course, it might be a topic for discussion. Thank you very much.